Welcome to today's show. My name is Michael Juberg, and I am with the Global Compassion Coalition, an online community with a mission to build a world based on compassion. Today, we have the privilege of speaking with Dr. Myriam Mongrain, a clinical psychologist and full professor of psychology at York University in Canada. She's an active clinician and researcher. Her positive psychology lab explores topics related to human flourishing, existentialism, and compassion based training. Thank you so much for joining us today, Miriam.
No, my pleasure.
Well, I'm so excited to meet you and learn more about your work. Coming from the field of compassion research, you have been doing so much wonderful work, and it's just such a privilege to be able to speak with you today and learn a little bit more about your work and perhaps your personal story.
All right. Sounds good.
Yeah, and so to maybe get us started, I'd love to hear a little bit more about your personal journey that really led you into this work.
Mm, that's a good story. It I started off, in psychology we have this saying that research is me search in psychology for researchers in the field, and that was sort of me when I finished graduate school. I was doing a lot of work on self criticism and depression. I had a very intimate understanding of depression and also found that it, as you know, is quite prevalent. And so I sought out for 20 years to study vulnerability to depression, including personality, including biological factors, environment, stress. So I had very fancy models that were helping me predict who was going to get depressed when. And at that point, I felt like, all right, the real culprit here is really this self-talk that we find in self-criticism that can get really pernicious and very damaging to both to mood and to the sense of self. So I thought, how can we help those people? What would be the best strategy for getting the self-critic to focus outside themselves? And then at the time, Martin Seligman's research was coming out, and he was showing that these brief online interventions were creating changes in happiness and improving mood. And it seemed like, oh my God, this is too good to be true. So let's see whether people vulnerable to depression could be helped using brief online interventions. And this is how I started looking at positive psychology exercises. I replicated Seligman's work and then looked into more specific types of exercises that I thought would target vulnerability to depression. And so, with something like self criticism, I really believe that a focus outside the self and a intention to help other people would bring relief, a relief from the unrelenting self attack that we see in self critics. And so that was the initial impulse. And then, of course, in several papers, I did find that these positive psychology exercises were effective in producing change, decreases in depression, improvements in happiness, and so forth in the short run, and in some cases over the long run.
So many
Mm-hmm.
people are affected by depression. And when we think about depression, you're kind of mentioning that self criticism plays an important role in maintaining depression. Can you speak a little bit more to that specifically?
Yeah. So self-criticism, if I were to explain it in layman's terms, is kind of always scrutinizing yourself. There's an internal voice that's kind of taking note of what you're doing, how well you're doing it, making judgments about what you've just said or what you might have done or your performance. And these this critic, this internal critic, is quite active. I mean, almost all of us have this internal voice. Um, but for some, it's especially harsh. It's very judgmental and is just looking out for mistakes, for flaws, for imperfections. And then it starts a commentary, you're not good enough, this is not enough. And I think that, I mean, in therapy, we work with the critic and we try to soften the critic. And but most people don't receive therapy, and so they live with this internal judge that, if unchecked, can really wreak havoc on someone's mood, and it's very subtle. We're not always aware that there was a self-judgment, and that as a result we're feeling more anxious or a little more down. But it's a dynamic that's very powerful um, in mood and shifts in mood. This is
I
one
think
side of vulnerability.
Yeah, I think you are. I mean, and as a clinician, we see that, right? That self criticism is an important factor, right? It's not surprising that the people who are having the most difficult times sometimes have, like you said, kind of that inner critic, right? There's a
Um,
lot of models of therapy that treats depression really encourages people, let's get them moving again, right? We call that behavior activation, right? That's kind of the main in cognitive behavioral therapy. But I'm curious,
mhm,
because does that really target that self-critic? Perhaps it increases
mhm,
self-efficacy. Perhaps people, as they're more active, they just generally feel better. But does that target that self-criticism? And if
mm.
not, is what you're suggesting with these kind of compassionate actions doing that a little bit more directly and affecting the thing that's making people perhaps most depressed? What do you think about that?
Yes, yes, that's a great point. So behavioral activation is the number one intervention that is recommended for people who are depressed. And that really does speak to that relationship between physiology, mood, and self referential thinking. So I believe what happens with individuals who are more seriously depressed is you need to get them moving. And by getting them to go outside, to start jogging for a bit, or just taking a brisk walk, you're introducing a shift internally, not just physiologically, but also, that self referential loop, the default mode network that we so often hear about is kind of like shifted to some extent. The person is looking out, the activity itself is changing, the environmental input. And and I think that this is all you need, is a bit of a shift, and the person also feels a little more self-efficacious afterwards. So it does help with those um, heavier or maybe even more serious types of depression. This is how you start, but the critic is still there. And it this is therapies that work with the cognitive aspect of depression will look at those beliefs about the self and the whole process of judging yourself so harshly. So, if it was accompanied with behavioral activation, I could see, for example, someone who's been instructed by their GP to go out for a brisk walk 10 minutes a day, and then they finish their walk and they go, "Oh God, I wasn't even able to do this well enough. I'm such a loser." And they go home and the cycle starts again. So it's that process of self-evaluation, that critic that is making those judgments, that has to be wrestled with. And this is difficult to do in therapy, but it's not impossible. And often people will acknowledge that they're not even that harsh on their friends. Like, why should they continue to treat themselves that way? So, it helps to get to the origin of those criticisms. Often it comes from a parent, Often it's been internalized messages that the person doesn't even understand the roots, right? So you can go that way and dismantle those beliefs or those that judgmental process. But I think there's other approaches that we know of now, including mindfulness, including ACT, which is a therapy that puts the individual in a position of maybe a little bit more objectivity vis-a-vis their thinking. So taking a step back and looking at your thinking, which is kind of what we do in meditation. But I think that ACT has formalized the whole learning to identify these thoughts as they come through your mind and learning not to identify with them. So that is key. This is just a thought. This is not my identity. And, the key is really learning to see the thinking mind as just a manifestation of, what we've done, what we've learned to survive and cope with our environment, but it's not the ultimate truth, especially not when it comes to self-evaluations. So there's a whole lot in here, and it takes, I think, a very serious approach to either meditation or therapy, or even you know a deliberate practice, perhaps, to learn to not get caught in all the thinking.
Mhm.
And
And how does compassionate action help somebody transcend their own, perhaps narrow thinking?
yeah, well, okay, so here we're back in this area of positive psychology and positive psychology exercises that are predicated on a very fast and kind of dirty approach to changing mood, in the sense of having instructions that can be delivered to a large number of participants and that require 10 minutes a day and that are easy to implement for participants. That's the positive psychology exercise framework. And so we don't have really the luxury of exploration or the skills that I was mentioning earlier, but you can ask people to go out and do something kind towards someone else, either an acquaintance, a neighbor, or you can even focus on close relationships and say, this is so important for an individual's well-being. And we know that when you invest in others, you're really investing in yourself, and give them instructions to perform an act of kindness in those significant relationships on a daily basis for something like a week or 2 weeks, and you can notice effects of doing that. Now, what happens? What are the improvements in mood related to? I think it has a lot to do with getting outside yourself. And when you perform an act of kindness towards someone, especially someone whom you'll see again, someone who is part of your network of relationships, you're creating a positive, um, grateful environment. And this is kind of the beginning of a cycle that can lead to a much more positive social environment ultimately. So the environment, being perhaps more positive towards you is one way to get at the negative cycle that depressed people experience. They're not in a good mood, they're negative. People are alienated from them. And so this is one way to get into a more positive feedback cycle. This is possible. I have data which is more specifically targeted at personality and different personality types who profit from compassionate action. But just generally, I would say participants, whether they're depressed or not, see an increase in happiness after a week of practicing kindness on a daily basis, and they seem to maintain higher levels of happiness 6 months later. And it seemed to work through self-esteem in part. It increases people's self-esteem.
Yeah, and when I saw that paper, is this the one in the Journal of Happiness Studies? And so, what stood out to me is that that was, like you said, a brief compassionate action exercise, right? And that was even delivered online, where the instructions were given to the group, just not in
Mm-hmm.
person, not in classroom, but just online instructions. And that simple intervention had benefits up to 6 months. And naturally, we think about, well, geez, if I have a patient who's depressed, if I have a friend who's depressed, if even I myself am depressed, and 1 week of acting with intentional kindness led to these improvements of happiness and self-esteem up to 6 months later, what would that be like to live like that? What would it be like to do
Mm-hmm.
that for a year, for 2 years, since you were a kid, right? It almost seems to suggest that this could be a really important element in mental health and one's own stability. Would you agree?
Yes, I would agree, except that we have to look at, I think it has to be qualified. We have to look at the magnitude of the effects. And I think it's not, wouldn't be surprising to you if I said, if we look at the means on happiness before and after the intervention and 6 months later, yes, there's a significant increase, but it's not like, oh, it's still rather qualitatively small, in the sense of we see a 1 point increase on a 5 point scale. You don't go from being unhappy to being ecstatic. You go from being a little bit happier. And maybe that's the best we can hope for, is to become a little bit happier. But I think through all this, it's not just, you see, the thing is, people sometimes feel like, okay, I'm doing good, I'm a good person. Um, I think it's deeper than that. Yes, it can help with your self esteem, but it's also about addressing something that is really core to human beings. When we make a difference in other people's lives, it changes us. It makes us just kind of, gives us that eudaimonic happiness. And what I mean by this is a sense of meaning, right? It's not like feel good happiness. It's just like, yeah, you know, I made that person's life a little bit better. I have a reason for being here. And that whole eudaimonic happiness and how important that is for our well-being, I think shouldn't be underestimated. It's different from hedonic happiness. So the results from that study that we were just discussing, looked at happiness in a broader sense, the broader definition, and the improvements are significant. But I don't think it's the solution for everybody or the solution to an ecstatic life. I think we have to look at what brings people a greater sense of meaning. And I think when they explore that, they will come to that conclusion that making a difference and focusing outside the self seems to be a really good investment in terms of their own sense of emotional well-being.
Yeah, that seems very central, right? I think a lot of Western notions of happiness pertains to how do we feel ourselves? What are we thinking? How are we doing? individually, right? Whereas I think what you're talking about kind of expands this notion to be interpersonal, right? How are we situated within a group of people, even just between a dyad of people, right? It's really
Mm-hmm.
beyond ourselves that we find that happiness is situated. And I think a lot of the positive psychology that we're seeing coming out really points to this, that this isn't just a luxury of mind, that this is essentially what it is to be human, is that when we are not just focused on ourselves and we're interested and invested in the well-being of others, we ourselves flourish more. I think that's
That
important.
I think we have to also think about the individual and where they're at in their lives. And we look at young people today, especially in North America, and we have this incredible individualistic orientation, a focus on, I mean, social media is just that. How do you compare to others? How do you look compared to others? How many followers do you have compared to others? It is so competitive and also focused on external factors like appearance, money, status, popularity, and all of that is misdirected. It is the wrong orientation if we want, young people to be happy. And so we're seeing the consequences of that emphasis on those values like wealth and popularity that don't bring lasting happiness. It's hard for young people to believe that, though, right? They've been raised with a phone, and for them to not believe that somehow if they show up online with something spectacular that everybody likes, of course it does reward the person, right? You get all those likes and so you feel good, um, but that's not long lasting. So what I'm describing has a lot to do with a revelation that occurs through development, and that has a lot to do with experiences. Some experiences maybe have to be had in order to realize, wow, this isn't making me so happy, or not lasting happiness. And I mean, it might take some time to come to that realization, but I still think that the conclusion is exactly what you said. It's more collective, and it's more. I think there's evolutionary reasons to believe that this is how we got here, is through cooperation and helping one another. That's the single most important reason why we did so well as a species. And so the competitiveness is also there, but without the cooperation, we're doomed. I mean,
And I actually enjoy that. I like the fact that evolutionary psychology supports a lot of this work, and that it's coming
mm-hmm,
late into therapy, but one could argue that this is really how we started: is orienting towards one another, learning to cooperate, learning to be forgiving and kind, and that way we have survived so long because of that. And so to sit there and kind of
yeah,
now just rediscover, like, what are these neural pathways doing? Why do they support our well-being so much? It's almost
mm-hmm.
we're almost late to the game, right?
Yeah, yeah. But if we listen, though, if you listen to what things feel like inside and you pay attention to the feel good effect of doing good, some people know this, some people already know this, right? But it doesn't, like, evolution gave us this kind of motivation to help other people. People love helping. It's like some people go out of their way to help because they really like how it makes them feel. And I don't think that's a moral choice. I think that's built in. Um, So it came later, but I think too for survival, and you'll see this, those I can't help but think of politics and or people that we see as influencers who are more narcissistic, and they might get a lot of attention, but I don't think ultimately they would get a lot of help when it came to survival. So I think that that orientation towards others also served the purpose, which was to keep us alive. Yeah.
I like that, and actually, I kind of maybe on the same note, maybe we'll talk a little bit more about personality theory. I know that one of your papers specifically looks at the five-factor personality theory, and specifically, it kind of maps a few of those factors on pro-social traits. Can you tell us a little bit more about that?
Yes. Okay. So the five factor theory of personality is the dominant model right now in psychology. Um, it's been the dominant model for like 30 years. So it is statistically very powerful in explaining differences between individuals. So when we want to sort of think in terms of traits and what makes one person different from the next person, their personality traits can be summarized by five factors. That's the summary of all of those individual differences. If you factor analyze them, which is a statistical technique to see whether some traits tend to go together and some packages, what do you end up with? Well, we end up with five neat packages or pretty neat packages across the world, across continents. These five factors are neuroticism, so whether you're emotionally stable or unstable. We have extroversion, which everybody knows. Are you outgoing and looking for social contact, or are you more introverted? The third one is conscientiousness. So, do you tend to do things very well? Are you concerned about rules and organization versus being less conscientious? There's agreeableness, fourth factor. So the agreeable person is the pro-social type who cares about other people's feelings, very sensitive to others, and being kind, tender, versus the disagreeable type. So I'm giving you the poles here along the dimension. And the last one, openness to experience, is really just that. How open are you to various types of experiences, whether aesthetic or ideas or emotions, versus being more closed and conservative? Um, and so here we have the five dimensions that tend to account for the most important basic differences that we see between people. And of course, it's satisfying up to a point. I think it does summarize the individual well. And when you don't know anything about a person, you would probably start there. Want to know their big five scores. Um, but then all of us have unique combinations. We're much more complex than five dimensions. And of course, the different combinations of those dimensions also leads to interesting types. Um,
And so of those five factors, are there anyone that seem to map onto like pro-social tendencies and more of that compassionate action propensity?
mhm. Yeah. So the in its description, agreeableness seems to be the most closely linked to pro-social action. So we look at things like volunteering or being polite, being compassionate in a situation. Those who score high on agreeableness definitely um, would engage in those behavioral manifestations to a higher degree. I mean, that's been shown empirically. In my own studies, when I looked at compassionate action performed on a day-to-day basis, I also found that conscientious people did more acts of compassion. This is outside of a intervention. This is just natural um, reports or a naturalistic study with people's self-reports. And conscientious individuals might be more likely to help a relative who needs their help, right? They're acting out of duty. But the agreeable type is the one that I found to be related to outcomes with interventions, including acts of kindness. And more specifically, when I looked at agreeableness versus disagreeableness, it was the disagreeable individuals who had the most to gain from a kindness exercise. Like their scores on depression went from moderately depressed to not depressed over a number of weeks. And so that was extremely striking. And it was acts of kindness, meaning when I compared it to another kindness intervention, which was a meditation exercise, loving kindness meditation, turned out to be a fabulous comparison where I found that people like doing the loving kindness meditation and it might have nurtured that compassionate instinct, but they did much better when they invested in their relationships more concretely, when they did the acts of kindness in close relationships. And, when you compare disagreeable to agreeable people, so you can do that with your data set, you can identify individuals who are in the top 20% on the agreeableness scale versus those who are in the bottom 20% on the agreeableness scale. And when you do that, you find really striking differences. Agreeable people don't seem to really need this exercise. I think their moods start off pretty average, but okay, not in the depressed range. And they kind of might gain a little bit from doing the exercise, but then they go back to normal. And I think it's because we don't introduce anything new for them. But for the disagreeable participants, they show a very significant drop in depression that is maintained over time. And that is like the story of the Grinch, whose heart grew by 4 times its size and then became happier by the end of the story and learned to give and to benefit from giving, so in other words, for the disagreeable person, I think we're introducing a skill in a repertoire where it's pretty dark at the beginning. They're very cranky, they're very hostile, and they're not happy. And by the end of the study, they're no longer showing these signs of depression. And yeah, and I have anecdotal stories of participants actually who, were definitely of the Grinch type at the beginning of the study, and the testimonies from significant others at the end were that this person was totally transformed and finally a nice person that everybody loved to spend time with. This is a grandpa who was a pilot participant for one of my graduate students. He just fell on this condition of acts of kindness. And apparently, from my graduate student's standpoint and from her report, she says, wow, he became very, very different and happy and forthcoming and interested in his grandkids and seemed like a big change. So I'm using that as an illustration. Um, I have the graphs to just show that the means do drop precipitously for disagreeable people, the very disagreeable people. And so I have reason to believe that when the person hasn't discovered a skill, and I think this might hold for other person activity fit in positive psychology, when you fall on a skill that you haven't discovered yet, it might bring you benefits that are, both significant, but also life changing in some cases. Yeah.
I love to hear that, and I think heuristically that maps onto a lot of what I see clinically. I'm a pediatric therapist, so I work with adolescents. And I noticed that some of my youth who are having a hard time and struggle, and sometimes it's anxiety, depression, sometimes it's personality disorders, and they tend to be, like you said, highly disagreeable. Oftentimes, I'll recommend that they join some form of community, and that tends to turn things around pretty quickly. And it's interesting because again, it depends on which model we ascribe to, but what's going on that the second that these people are doing these acts of kindness, that people feel pretty good. They feel self-efficacious. They feel like their worries are contextualized. Maybe there's a sense of common humanity that, hey, I'm not the only one out here having a tough day. And actually, I'm in a position to even help somebody in this moment, even though I feel less than optimal. And so we see that happening pretty quickly, that people return to this, perhaps, like you said, a natural state where when we are beyond ourselves, when we're living in this interpersonal context, that we feel more at balance with ourselves.
Yes, I think that's well said. Also, if you think of the unhappy teenager or the cranky old grandpa, they're isolated. And that's not a good place to be if, your friends don't like you, or if you've alienated yourself. I think this is misery. And so acts of kindness is kind of like a way to get people to engage with their interpersonal world in a positive way that is almost guaranteed to provide positive feedback. And the feeling of being integrated in a group, not being alienated, but belonging, I think is so important for human beings generally. And so sometimes it's something like that. It's an intervention as simple as that that allows that point of entry, um, with the social world.
Actually, I think that's probably my final question for you is, we know that compassion based interventions help, right? With emotional well-being. There's even some physiological correlates that suggest that this is really quite healthy. Do you think that we would ever be at the point that we are prescribing compassion based interventions for psychopathology, or is it something that we would make standard in a part of a socio emotional learning context, that this is so critical for what it is to be a healthy, functioning human, that it's not like you need depression or you need to have these personality disorders, that just by simply being one of us, a human, this is important to learn. This is something that it's important to teach people early on, perhaps in education. And for those who are kind of still an outlier, maybe that's when, there's wellness interventions or even psychological interventions that really target that. Do you think that we need an intervention
Mm-hmm.
for compassion, or is that something that,
Mm.
perhaps can happen a little bit more naturally? What's your sense on that as a clinician?
Yes, well, I have data that shows that if you're helping for the wrong reasons, it might backfire. So we have to be careful when we prescribe compassion or when we prescribe acts of kindness. And I'll just tell you a little bit because the intention matters. If you're doing it because the researcher told you to do it, or because it's earning you community credits, if you're doing it, in other words, if you're doing it without the proper intention and motivation to really want to ease the suffering in someone, um, then your mood might not benefit. And I'm speaking from some recent results where I found that participants, when they reported on their acts of compassion, and said and rated also whether they felt obligated to act this way. Let's say this is someone who's feeling like they really should help their partner because the partner is struggling, and they're going to feel guilty, or the partner's putting pressure on them to help them. When you do something compassionate because you felt externally pressured to do it, we see a decrease in positive mood and increase in negative mood. So it's not automatically going to benefit the individual. So here we're talking about how to do this out of your own free will and your own knowing that it's a good thing to do, that it's the right thing to do. So I'm not sure yet of the formula for increasing compassion, but my sense is that we're going to have to decrease values that are placed on other things. Do you know what I'm saying? Like, I think you have to reduce people's need to get ahead. I mean, it's about helping people understand that they have nothing to lose, really. Something like that.
Beautifully said. We really appreciate you sharing your wisdom and your passion with us. We certainly look forward to following your work and hearing the developments over time. Thank you so much for your time, and we really appreciate you joining our show.
It's my pleasure. Good luck to you.